Hi, Dr. Raj here, and today we're going to talk about POTS, Postural Orthostatic Tachycardia Syndrome. This has been seen on the board exams. It's often clinically underdiagnosed and misdiagnosed. And what do I want to talk about is how it gets confused with vasovagal syncope and orthostatic hypotension. So first, let's define POTS. Let's break down the word, which means it's postural relating to position, orthostatic, which means that from a sitting down or lay down position, you do feel the symptoms when you stand up or get up. And the key words are tachycardia. So there are very specific criteria, meaning that for adults, if you stand up and your heart rate increases from more than 30 beats per minute from your baseline, or within 10 minutes, it goes up to greater than 120 beats per minute, that's going to be part of that diagnostic criteria. And the key word is syndrome. So you got to have other symptoms, such as during that motion of standing up, are you dizzy? Are you lightheaded? Yes, it sounds a little bit like orthostatic hypotension, but also other symptoms like chronic fatigue and very poor sleep, which is why I see it as patients that come to my sleep clinic. When we talk about orthostatic hypotension, it does get confused. Think of orthostatic hypotension in individuals who are older in age, on certain medications. When they stand up, their blood pressure goes down. And of course, they have that kind of reflex tachycardia, but they don't have other parts of the syndrome. When we talk about POTS, there is not a big change in blood pressure, but definitely an increase in the heart rate that we talked about already. And of course, the other parts of the syndrome. When you have vasovagal syncope, think of the word. Vaso means vasodilate, and vagal means your heart rate goes down. They become bradycardic, not tachycardic. And if you want to diagnose POTS, you have to do this kind of a little barbaric test called a tilt table test that we used for vasovagal syncope, but also for postural orthostatic tachycardia syndrome. And when we talk about management, it's multifactorial, lifestyle modifications, diet, exercise. There are medications. They're not FDA approved. We think of things that control the heart rate like beta blockers, helping out with the blood pressures, medications like midodrine, giving salt tablets, or fludrocortisone, which mimics aldosterone, to help out with that sodium retention. Please know POTS for the board exams and for better patient care and identifying it, because once again, it's often misdiagnosed or underdiagnosed. I hope these are great pearls for your board exams.